turn to Diweddariad, the health spokesperson for Plaid Cymru. Good afternoon, Rhyn. As far as these national set of restrictions are concerned, Vaughan Gething said that it would just be far simpler for the public to know what they can and cannot do. Would you agree with that?
Yes, to an extent. We in Plaid Cymru were very supportive and indeed called for this national fire break. Probably would have been better to bring it in a little bit earlier, but we were happy to have this period. And I also support bringing that nationwide approach to an end at one point. The question then is what happens after that point, which is a minute after midnight on this Sunday evening. And the question that was posed by a number of journalists there, posed by myself here is, can we treat every part of Wales as being exactly the same on the way out of this fire break? Now, I'm of the opinion, have been for some time, that we need a more localised approach. That could be on a regional level, it could be on a local level, a county level, it could be on a hyper-local level, even a town or a village, if you can pinpoint an outbreak. And it's clear that we currently have a situation where there are some parts of Wales that are particularly worrying. We heard them named there time and time again, YMATEB, Gweinidog Iechyd. And the question is, how does government respond to that? And to me, I'm not satisfied with just hearing the minister saying it's fine. What I want is, it's fine because this evidence says X, this data says Y, and that is why we can move ahead on Monday treating those areas like any other part of Wales. And I want more of that information from government, whilst not wanting anybody to live in restrictions for a second longer than they need to.
No, but Vaughan Gething didn't say it's just absolutely fine to leave certain areas with high rates of coronavirus. He did say that we're supporting our successful contact tracing service by creating a surge team which can be rapidly deployed when the number of people testing positive rise sharply in a particular area. And they're also launching a £500 self-isolation payment scheme for people who have to self-isolate. So they are taking steps to deal with those hotspots.
I'm not suggesting for a second that they're not taking notice of what's happening in those areas, and they would be taking those measures. I'm pleased we've been calling for that, certainly that self-isolation financial assistance, because that's vital. The last thing you want is people feeling they have to continue to go to work if they've got symptoms or even a positive test, because otherwise they feel they can't put food on the table. But if the minister is insistent now that he will not consider some sort of element of elevated restrictions for those areas that have been mentioned, what about other things? For example, Liverpool is a part of England that there's been a lot of focus on over the past weeks because of very, very high prevalence there. What they're doing in Liverpool is they're going through a period of universal testing now. How about putting something like that in place in YMATEB, and Gwynhadledddd? So we have that kind of concentrated, focus on highlighting exactly where the cases are, getting people to self-isolate and bringing down the case numbers, because these aren't just numbers that are slightly higher than other parts of Wales. We're talking about very, very high levels. And to me, that rings alarm bells. And I want to see the evidence, the data from government, and every effort possible made to bring that down for the sake of the people living there. It's all about people's health.
Okay, you mentioned testing there, Mr Gething did say that in Wales, the Public Health Wales test, there will be more mobile testing, should start to see our regional labs start testing over the next week, and they will give a 24-hour result. Now, you had asked for the Welsh Government to make use of this firebreak fortnight to improve the testing system. Is that enough for you?
No, I'm still not happy. We heard the figures there, didn't we? If I made notes correctly, 39% of lighthouse tests coming back in one day. That's woeful. My daughter had a test in London last week. She's fine. It was negative. She got the result back in 18 minutes. That's the kind of technology that's being rolled out now. And yes, there's work going on in Wales now to bring in more of that kind of testing. But to have significant numbers of tests still taking 2 days more to come back, it's not good enough. And we're not conducting enough tests. We're not getting them back quickly enough. And that is the foundation for that tracing regime, which we have got a good one in Wales. It's the foundation for getting people to isolate and bringing down case numbers, whether it's in Merthyr or Gwynhadledddd or Gwynhadledddd or anywhere else.